The House will now proceed to the consideration of private members' business as listed on today's order paper.
Affaires émanant des députés. Resuming debate on the amendment of Mr. Malo on the motion of Mr. Rajotte, M574, Alzheimer's disease.
Honourable Member for Ottawa Centre.
Thank you, Mr. Speaker. I rise today to speak to the motion that has come before this House that is addressing, I think, something that we all have been affected by through family, through loved ones, through members in our community, and that is the issue of Alzheimer's. Mr. Speaker, I think everyone in this House acknowledges that there is a role for the federal government to deal with Alzheimer's in a serious matter. And I guess, Mr. Speaker, if we put it in context, it's akin to in this House where we have discussed other issues that have been areas of health care where, frankly, they're issues that we haven't seen in the manner of which we've seen in the past 10 or more years. I'm thinking specifically of issues like autism, ALS, and of course Alzheimer's. These issues, if you look back to how our healthcare system was constructed, and back to the 60s and into the 70s when our healthcare system was formalized, and then of course in the 80s with the Canada Health Act, they didn't contemplate those initiatives, the infrastructures, the things that we're having to deal with now, particularly something as proliferated as the phenomena of Alzheimer's. And that's why, Mr. Speaker, I think that it's important that this motion from my friend from Edmonton-Leduc is important to be not only debating in this House, but to seize the opportunity to engage. Some have called what we're seeing in Canada with regards to Alzheimer's a great tsunami. You know, the numbers are fairly significant, and I think the numbers only speak to the proliferation, and I think the individual stories speak to the impact. But the numbers, I guess, are important because when we deal with policy, often we have to take a look at statistics. We look at 1 in 6 women and 1 in 10 men who reach the age of 55 can expect to develop Alzheimer's. That is staggering indeed, Mr. Speaker. And we see a disproportionate number of women being affected by this than men. So there is certainly a gender difference here. But the point is that Alzheimer's, as an effect on our society, and the ripple effect, kind of Doppler effect, is hugely significant. It's not just about the 1 in 6 and the 1 in 10, Mr. Speaker. It's about the fact that this so affects individuals and families, communities at large. I have a couple of friends of my parents who suffered from Alzheimer's. There are family members of all of us who we know and love who has suffered. And what is so drastic about Alzheimer's is it robs people not only of their ability to take care of themselves, but it robs their ability to actually function in a coherent manner, to even recognize people that they lived with and loved their entire lives, to have, in the instance of a friend of mine, not being able to even recognize their grandchildren, not to be able to recognize friends. That is profound, Mr. Speaker, because it gets at the heart of what makes us human in a sense. That is our individual relationships. That is our ability to see the world and understand it and feel it and touch it. And you know the profile of Alzheimer's is different for each person, and that's something else that is extremely important to understand. Like autism and people who are on that spectrum, Alzheimer's, there's no one case of Alzheimer's that is the same. And it's because of the way, and we're just learning a little bit about this now, Mr. Speaker, of how the brain functions, is that when it is in a state of suspension, that it is very difficult for us to even understand what it is like for someone to go through this. So we can't say, like other ailments, that we know that this is the profile, here's how we treat it, and all of the diagnoses are going to be similar, and therefore the prescriptions. Alzheimer's requires, I would say, a much more human dimension and human capacity to help people. Similar, as I said, to areas where we've learned a lot more in education, like autism. I think it's important to understand, Mr. Speaker, what our role is as Parliament. I think the role is as Parliament is that, as I mentioned before, Alzheimer's wasn't something that we were aware of when our health care system was being put together. And what we know is needed in our country is a strategy for dealing with people and their families when it comes to Alzheimer's. We need to be able to create stability of care. We need to be able to provide flexibility of care. We need to understand that there's differences in the regions in terms of ability and capacity for people to access care for Alzheimer's. And we need to make sure that we're listening to those who have already gone through dealing with Alzheimer's. And that's where the Alzheimer's Society is so important. Here we have, Mr. Speaker, if you will, a civil society capacity that came together to help people who are going through a horrific experience. And the Alzheimer's Society, and there's the Alzheimer's Society of Canada, as well as chapters throughout the country, get it. They understand that there's no one answer, but they understand that there needs to be a comprehension in terms of our care. They believe that we need to provide communications for people to understand that they're not alone, that there's support. They believe that there's an important role here for government to be able to transform our healthcare capacity so that people and their families who are suffering from Alzheimer's actually are going to be able to get the help they need. And what they understand most profoundly, Mr. Speaker, is that when someone is going through Alzheimer's with their family, that it is important that they are not left alone, that they are not isolated, and that we, and I mean the royal we, are there to support them. What does that require, Mr. Speaker? Sometimes very basic things. Sometimes it means that there's going to be the sufficient home care, not just for the patient themselves, but also for the person who's caring. What is not understood in this country is the amount of care that is done by families, and that people who have to put their careers on hold and put their income aside aren't getting the recognition and support. That's something we have to grapple with, not only as we see a proliferation of Alzheimer's, but as we see an aging population. These things go together. So, Mr. Speaker, I think when we look at this motion that has been brought forward, when we look at what the possibilities are in terms of dealing with Alzheimer's, we need to make sure that not only is there a role for the federal government and there's support for the Alzheimer's Society and the capacity at the community level. What we need to make sure, Mr. Speaker, is that when someone and their family is suffering from Alzheimer's, that they indeed are not left alone, that they aren't walking the path of dealing with Alzheimer's solo. And I think, Mr. Speaker, if you look at the successful models for dealing with Alzheimer's, they all have something similar, and that is access to basic services, and that's a straightforward healthcare policy, but in tandem with the community supports that exist. And so what I hope to see from this motion is not just a debate in this House and support of a good intention here, but that we also see direct action, that we support at the federal level our communities throughout this country, so those who are suffering from what some call the fog of Alzheimer's will have support to make sure they are not alone and that they are supported and that we do our job here as a Parliament to support them. Thank you, Mr. Speaker.
Resuming debate, the honourable member for Kings Hands.
Mr. Speaker, today more than 500,000 Canadians suffer from Alzheimer's and other related dementia. In fact, it's the single biggest cause of disability among Canadian seniors. It's a disease that takes away more than someone's memory. It takes away a person's identity and their independence. Treating this disease can be physically and emotionally exhausting and even fatal for the caregiver. With an aging population, the incidence of Alzheimer's in Canada is rapidly increasing, and this is a global phenomenon. At its most recent annual meeting in Davos, Switzerland, the World Economic Forum called Alzheimer's, quote, a medical tsunami waiting to happen. Here in Canada, experts in the field are calling for a national strategy on Alzheimer's and dementia. And earlier this year, the Alzheimer's Society published a report called Rising Tide, the Impact of Dementia on Canadian Society. This report is helping to advance our discussion on dementia, gives us a clearer picture of how this epidemic is affecting Canadians both today and how it will impact Canadians over the next 30 years. For example, the report shows that as of 2008, 55% of Canadian seniors with dementia were still living in their own homes. In 30 years, this number is expected to increase to 62%. Put in another way, Canada must prepare for an additional 500,000 seniors who will be trying to cope with the effects of dementia while trying to remain in their own homes. And it's true that home care is often the best option for patients, provided they have the care they need, the home care they need. But it's not always the case, and in many cases, there are too many patients with dementia who simply cannot remain in their own homes, are left in their own homes, not by choice, but by the fact that there is inadequate public resources. There aren't the beds, there aren't the rooms for them in places where they can be taken care of in a humane and responsible way. The shortfall in 2008 was over 15,000 beds, but this number is projected to explode to more than 157,000 long-term beds within 30 years. There's going to be a massive increase in the burden placed on family caregivers from coast to coast to coast. The Rising Tide report places the economic costs of Canada's dementia and Alzheimer's epidemic at $15 billion per year. In 30 years, this economic burden is expected to grow to $153 billion a year, which includes $56 billion annually in lost wages for caregivers. This doesn't include, Mr. Speaker, the significant human cost of the disease, both for patients and caregivers. Many of the caregivers feel absolutely overwhelmed by the terrible effects this disease is having on their loved ones. They are looking to governments for leadership and for help. And there is hope that the situation can change for the better, but it's going to require action. Canada needs a national strategy on Alzheimer's and dementia, and we are one of the few developed countries without a national strategy in place. Important work towards a national strategy is being done by groups and organizations, including the Canadian Dementia Action Network. However, the current Federal Minister of Health has refused to meet with them. Mr. Speaker, last January, when the Conservatives prorogued Parliament, the Liberal Party held a roundtable on Alzheimer's and dementia. It was co-chaired by our leader. We brought together leading experts, including Scott Dudgeon, the author of the Rising Tide report, and others, and leaders from civil society organizations, caregivers and patients. They discussed the need to support research into better treatments as well as a cure, increased prevention and awareness, enhanced integration and coordination between researchers and frontline support, and also income security for caregivers. And at the roundtable, our leader, the Liberal leader, committed to a national brain strategy to lessen the social and economic impacts of dementia. And our roundtable on Alzheimer's and dementia played a significant role, which led us to our family care plan, the Liberal Family Care Plan that was released in October. Mr. Speaker, I want to speak on a personal basis. On November 16th, of 2009, a little over a year ago, my mother was diagnosed with Alzheimer's. Mom is 81 years old. She has, during her life, been a successful and hardworking businesswoman, mother, and wife, and community leader. And the diagnosis for our family is a difficult one, has been a difficult one. She's got a wonderful doctor, Dr. Catherine Smith. She's got a terrific specialist in Dr. Kenneth Rockwood. And the drugs that were prescribed to my mother, we provided some element of hope in a way, Mr. Speaker, because there's a 33% chance that there would be some improvement, a 33% chance that they could stabilize the condition for a period, but then a 33% chance that the drugs would have no impact and her condition would continue to decline. There is nothing curative today. You can treat symptoms, but there's nothing curative. And a patient, the prognosis for a patient with Alzheimer's is always a bad one long term. I mean, the condition will continue to worsen. That's why research is important. That's why the research at places like the Dalhousie Medical Research Foundation is so critical. The work being done by researchers like Don Weaver and Dr. Kenneth Rockwood, Dr. Sultan Darvish is absolutely essential to finding a cure for Alzheimer's. A cure that may not benefit my mom, but may benefit somebody else's mom in the future. I want to speak on my own personal reflection on the caregiver issue. My dad is taking care of Mom. He's 87 years old. And when I spoke with this issue with my leader's mother died of Alzheimer's. My leader told me that in his case, his mother's Alzheimer's actually killed his father before it killed her. That happens a lot. The caregivers actually can die before the patient. And in my dad's case, he's 87. He had colon cancer in the 1960s. He had a triple bypass in 1987. He's had prostate cancer for 15 years. And he told me a few weeks ago that this is the toughest thing I've ever been through. My mother's Alzheimer's is the toughest thing that my father has ever been through. And I reflect on that, saying that Canadian families need help. Our family, my parents have 4 children who are trying. My mother is fortunate to have a husband who is doing everything he can to help. They need more help from home care support. A lot of Canadian families have it far tougher than our family. In fact, I was reading in the Globe and Mail a few weeks ago. The Globe did an excellent series on Alzheimer's. The story of a 26-year-old young mother who was taking care of 2 little kids at the same time she was taking care of her 52-year-old father who had early onset Alzheimer's. This sandwich generation that is emerging in Canada, where you have parents of young children taking care of their own parents at the same time, will only grow. That's why we brought forward the Liberal Family Care Plan, which will, for instance, provide enhanced EI benefits for family caregivers. It will also provide a family care tax benefit, very similar to the child care benefit, which will benefit disproportionately low and middle income families. Our Liberal Family Care Plan has received support from organizations including the Alzheimer's Society and the Victorian Order of Nurses, the VON. And I ask for all members of this House, regardless of the partisanship that often divides this House, I sense that around this issue of Alzheimer's and dementia, there is multi-partisan support, not just for words in this House in support of Alzheimer's research and care giving for families, but also that there's support for a real national action plan on Alzheimer's and dementia. And I urge the government to take serious action on this issue. It is a crisis that is going to grow with time. We are in this place not just to be looking at the priorities this week politically, but we're in this place to be looking at the challenges and opportunities facing Canada 10 years, 20 years, 30 years out. Mr. Speaker, tackling Alzheimer's and dementia has to be something that this Parliament takes seriously. I commend the member for bringing forward this motion, but I urge the Conservative government to take action.
Resuming debate, the honourable member for Saskatoon-Rosetown Bigger.
Thank you, Mr. Speaker, for the opportunity to speak on motion 574. I would like to commend the honourable member from Edmonton-Leduc for bringing forward this motion. Neurological conditions such as dementia can affect many aspects of an individual's life. There can be physical, cognitive, and emotional effects, in addition to stigma and social isolation. Among the more common of these conditions is Alzheimer's, and I'm sure we all have friends or family members whose lives have been touched by this disease. Alzheimer's and other forms of dementia are devastating and cause memory loss, impaired judgment and reasoning, impaired ability to communicate, and changes in mood and behavior. Over time, persons with this disease become unable to perform the activities of daily living that so many of us can take for granted. Dementia places a significant burden on family, friends, and caregivers. It also places demands on community health and social services and on long-term care facilities. Alzheimer's disease and related dementias most commonly affect seniors, who are also at risk of having other health problems, increasing the complexity of their care. However, dementias can also affect younger individuals. In 1 to 7% of cases, dementias develop well before the age of 65 and can affect individuals as young as 30. As the population ages, the number of people with dementia is expected to increase, including a growing number of people under age 65. Rising Tide, the impact of dementia on Canadian society, is the final report of an Alzheimer's Society project funded by Health Canada, Pfizer Canada, and other private sector sources. It predicts that the incidence of Alzheimer's disease and related dementias in Canada will increase from 1 new case every 5 minutes in 2008 to 1 new case every 2 minutes in 2038. Our government recognizes that understanding this complex condition and its impact on individuals, families, and communities is necessary in order to be able to develop effective programs and policies that will meet the needs of people with dementia, their families, and their caregivers. We are aware of the valuable contribution that informal caregivers make to Canadian society and are taking measures to ensure that our understanding remains current and relevant. In fact, the government has recently launched a 3-year external research program to fill important knowledge gaps. As well, in 2012, we will run a national caregiving survey to ensure that the best data is available to understand the challenges that caregivers face and that they have the supports they require to continue in their vital roles. In addition to research, the Government of Canada is committed to helping seniors remain healthy, active, and socially engaged. To start with, we've increased funding to $40 million annually for our New Horizons for Seniors program, which can make a real difference in communities by keeping seniors engaged, living actively, and participating in social activities. Every Canadian, regardless of their age or situation, should feel comfortable in and a part of their community. Mr. Speaker, it is debates like this that add to the knowledge and awareness of the issues around unpaid caregiving and support for families of persons afflicted with Alzheimer's and dementia. The need to better understand the complexity of neurological conditions such as Alzheimer's disease and related dementias has led to Canada's first ever national population study on neurological conditions. In June 2009, the Minister of Health announced an investment of $15 million over 4 years towards a study that will look at neurological conditions and their effects on Canadians, filling many current knowledge gaps. This study is led by the Public Health Agency of Canada working in close collaboration with the Neurological Health Charities of Canada, a collection of 21 charities, including the Alzheimer Society of Canada, joining forces to improve the quality of life for all persons with chronic brain disorders and their caregivers. Health Canada and the Canadian Institutes of Health Research are also partners in planning and coordinating this important work. In planning the national study, the Public Health Agency of Canada and the Neurological Health Charities of Canada have worked closely with the neurological community to identify the community's needs and priority areas for the study. This included a wide-reaching public consultation with more than 3,000 persons affected by neurological diseases. A plan has been put in place for the 4-year study and is currently in its 2nd year of implementation. Expert advisory groups, including researchers and stakeholders, are providing advice on each component of the study. A call for proposals was issued and projects have been reviewed. Successful project teams will be invited to present their planned work at the first annual progress meeting in winter 2011. As part of the study, the Public Health Agency of Canada is working with Statistics Canada to conduct 3 surveys on neurological conditions. The surveys will focus on the numbers of Canadians living with a neurological condition in Canadian households and in long-term care facilities, as well as the impact of these conditions on individuals and their families. As many people with dementia are living in long-term care facilities, it will be of great value to understand the number of people in these facilities with dementia, as well as other neurological conditions. By expanding the Public Health Agency of Canada's Canadian Chronic Disease Surveillance System to include Alzheimer's disease and related dementias, as well as other neurological conditions, the study will leave Canada with the legacy of a timely and ongoing source of national data on the number of new and existing cases of these neurological conditions to inform public health action. In the final year of the project, an analysis of the future impacts of neurological conditions in terms of numbers of people affected, quality of life, and economic impacts will be produced. A consensus meeting will be held at the end of the 4-year study in 2013 to bring all the available study findings together. A report on neurological conditions in Canada will be developed to summarize the key findings of this suite of studies. Over the next 3 years, the National Population Study on Neurological Conditions will gather information about the numbers of people affected by brain conditions in Canada, the impact on individuals and families, health and community service needs, risk factors, and other health conditions that affect people with conditions like Alzheimer's disease and other forms of dementia. The outcomes of this study will provide valuable information to guide policy and program planning for people with Alzheimer's disease and related dementias, as well as other neurological conditions. Alzheimer's is a devastating disease and touches far too many Canadian families. I hope that all members of the House will join me in supporting this very important motion. Thank you, Mr. Speaker.
Resuming debate, a please du débat. There being no other members rising, I will go to the honourable member for Edmonton-Leduc for his 5-minute right of reply.
Well, thank you very much, Mr. Speaker. Mr. Speaker, I introduced this motion in an attempt to have a national discussion in our national parliament on this very important issue, and I think that has in fact happened. I would like to take this opportunity in my wrap-up remarks to expressly thank the people in this chamber who have spoken. I'd like to thank the member for Etobicoke North, l'honorable député pour la Patriote,
The Honourable Member for Verchères-les-Patriotes,
Elmwood, Transcona, Oak Ridges, Markham, Ottawa Centre, Kings Hants, and Saskatoon, Rosetown, Bigger. As I said before, I appreciated both the substance and the tone of their remarks. I think it demonstrated what can happen in this national parliament when we focus on a very important issue that touches all Canadians. Mr. Speaker, just in conclusion, I do want to again thank the Alzheimer Society of Canada and their excellent study, Rising Tide, which frankly does an outstanding job of identifying the challenges of this disease and identifying some very real practical solutions that we should be working on. I also want to thank the Neurological Health Charities of Canada. They, in fact, have called for a brain strategy for Canada, which would be even broader than what we're talking about here in this motion.